Hi, everyone, and welcome back to Health First. Today I'm here with Dr. Porchia, who is an oral and facial surgeon. Hi, how are you?
Hi, I'm doing well.
Great, thank you for joining me here today. I'd like to start off by asking what influenced you to pursue a career in dentistry?
So actually my career in dentistry was not a straightforward path. I'm from Dallas. I went to the high school for health professions. And ironically, pretty much the majority of my life, I thought I was going to be an OBGYN. So the reason why I say that is because my senior year of high school, I was able to work in a gynecology clinic at Parkland Hospital here in Dallas. And that totally changed my mind about kind of what I wanted to do. So I went on to Xavier University of Louisiana in New Orleans. At that time, being a freshman, I knew I wanted to do something in healthcare. I just wasn't 100% sure of exactly what I was going to do. So I joined MAPS, and I'm going to mess up the acronym, but it's basically a program. It's a program geared towards minorities that are interested in healthcare professions. And I was able to shadow a dentist. I was able to shadow an oral surgeon, and that kind of led to the whole path to dentistry.
That's great. And you're an oral and facial surgeon. So,
Yeah.
why did you choose your specialty?
So yeah, so the technical term is an oral and maxillofacial surgeon. A lot of people can't say maxillofacial, so it's just easier to say oral and facial surgery. I think for me, it was kind of solidified for me when I got to dental school, and I would hang out in the oral surgery clinic all the time, and just kind of got an idea, kind of like what they were able to do every day. So um, I think that had a lot to do with, my pathway to becoming an oral and maxillofacial surgery, because I loved how diverse the specialty is. It's so many different things, and a lot of people will say it's actually it's so much different from traditional dentistry, because it's a specialty that kind of bridges that dental and that medical side of things.
Yeah, definitely. That's amazing. And can you tell me a little more about your profession and what you do?
Yeah. So as an oral and maxillofacial surgeon, it depends on the day, to be honest. My day is never going to be the same. Let's say if I'm in the clinic, it's probably slightly more kind of solidified on what we do. So let's say on a normal clinic day, we might be doing, extractions, like taking out teeth, like wisdom teeth, or we might be doing dental implants, or really complex dental implant cases where patients basically need a true oral reconstruction. So we might be doing a biopsy, or I might be doing like some lip fillers or Botox if we're trying to keep it fun, doing a lot of aesthetic things. If I'm in the hospital side of things, we'll be doing a lot of facial trauma, like if someone gets into an accident and they break their jaw, or they break their cheekbone or eye socket, which is called the orbit, things like that, or they have a really bad, what we call a laceration, a big back cut or something on their head and neck area. We'll be repairing that. Or even could be doing some kind of complex oral cancer or oral pathology or head and neck pathology or cancer procedure where, someone may have had a biopsy somewhere, and now we need to do something a little bit more extensive in order to get rid of that cancer. So it's a lot of different things that we do in our specialty.
Yeah, thank you for the insight. That sounds fascinating. And what do you like most about your profession?
I like the diversity of it. I like the fact that, I'm able to do so many different things. And it's so satisfying to be able to see a patient or, to get them out of pain, or, if they have a really bad abscess or a really bad infection where they can't sleep at night, or, they become what's called septic, meaning the whole body is basically can be infected. It gets into your bloodstream. So it's really satisfying to me to be able to help people to alleviate their pain. And then at the end of the day, to make them feel better and also look better. For me personally, I love facial cosmetics. So like I said, Botox fillers, we might be doing some type of facial surgery procedure. Those are things that I truly, truly, truly enjoy doing.
Yeah, definitely. What a large variety. And as you know, the COVID-19 pandemic has greatly affected the world and continues to do so. So how is it like working throughout the pandemic?
Oh man. So in the dentistry side of things, we also got shut down for a couple of months. But being an oral surgeon, I mean, even though we were shut down, we really didn't stop. We didn't stop really seeing patients because infections and things usually can't wait, or fractures and things like that. So working through the pandemic, it's scary initially because a lot of us, we didn't know, exactly, what this virus, what it was, or how extensive it was, and they're still finding out things about it. So the initial hit of it was kind of scary because working in the mouth, that which is where everything kind of starts, in that head and neck area. We're very, very high risk of contracting the virus. So it really made us, we were already well versed in the universal precautions, but it really, really made us tighten up a little bit, even more, get a little bit, I would say a little bit more OCD about how we're cleaning and how we're sterilizing and disinfecting things, wearing our PPE, which is called our personal protective equipment that we wear. So, making sure, we're wearing our N95 masks, I still wear like 2 masks, N95 masks, a surgical mask, we wear eyewear, face shield, of course, our gowns and gloves and things like that. But we have to make sure that we are protected, our staff is protected. Of course, our patients are protected, because typically the patients that we see in our office can truly be what's called medical compromise, meaning they have a lot of medical issues. So we have to make sure that they are safe.
Yeah, it was definitely very difficult. And now there's a lot of protocols that as I learned from other interviews, that
Mhm.
help like decrease the spread. So I
Oh
heard that
yeah,
there's very little spread in dental offices, which is great for patients,
yeah.
for dentists, for everyone.
Yeah, so we have to stay on top of that, and make sure that we're all being safe, and we're helping to slow down slow down the spread of this virus.
Yeah, definitely. And to end off, can you give a few words of advice to people hoping to pursue a career in dentistry?
For those of you that want to pursue a career in dentistry, I always recommend that you, number one, try to find a mentor, someone that you can shadow, especially if they're in like maybe a private practice that maybe your dentist or whatnot. Ask if you can shadow them one day so you can kind of get a little inside view on kind of how it is, or exactly what they do, or how their day-to-day life truly is. I think that when you see it, you can really get an appreciation for it, or you can decide, okay, hey, I don't think this is something for me. But those that are interested, definitely get a mentor that can help you in that direction of what you're trying to do or what you're trying to accomplish. Do very well in school. Of course, you still have to have good grades. You have to do well on your dental admissions tests. If you're not good at testing, I always tell people to make sure that you try to utilize some form of prep like Kaplan or Princeton Review, or something like that, to help you to help you take the test, because you truly do have to learn how to take the test. For those of you that are in college, when you first get in your freshman year, you need to start working on your personal statement. You can always take, your personal statement to your English department. They can look at it to review it for any grammatical errors or syntax errors or things like that. So that's always good, but make sure GPA, good DAT score, and of course, leadership roles and volunteering.
Mhm. Thank you so much for the great advice. And those are all the questions. So thank you for joining me here and thank you for your time.
Thank you. Thank you for considering me for this.